Good evening and welcome to our COVID-19 update. I am Ladi Akiridoluale. Here are the highlights at this hour. Grim news as Lagos State confirms there will be more cases to come of COVID-19, but lays out a response plan. Niger State government starts testing of 600 mercury for COVID-19. And United States records daily high of 40,000 cases of COVID-19 as thousands descend on British beaches as part of the eased lockdown measures. Lagos residents should brace up for even more confirmed COVID-19 cases over the next few months. And that's according to the State Commissioner for Health, Professor Akin Abayomi, who made this prediction at a briefing in Lagos. Professor Abayomi added that the state has accredited 5 private laboratories to join the state-owned facilities to meet testing capacity needs. He also named 3 private hospitals which have passed the test to treat COVID-19 and will be engaged for such services.
The Lagos State Commissioner for Health and his permanent secretaries are here to give an update on the COVID-19 situation in Lagos, as well as plans to tackle the pandemic in the state. The grim news is that cases in the state are set to go up for some time.
We are in the middle of the outbreak. We have not even peaked yet, and therefore we're still on the upstroke. The testing facilities, as we've established at the moment, are the Lagos University Teaching Hospital, or LUTH, the Lagos State Biobank, the Nigerian Institute of Medical Research, and the Central Public Health Laboratory in Yaba. We've also included some private facilities. The private laboratories are Total Medical Services, SynLab, 54Gene, Medbury, Biologics, O2 Medical Services, and Clean Lancet Laboratories.
But more labs could mean more confirmed cases, and more cases diagnosed means the need for more isolation space. This need is being handled partly by home-based care managed at the primary healthcare level for milder cases, and partly by partnering with private medical facilities.
We've licensed 3 health facilities now to improve the isolation space. And we have First Cardiology, Palon, Memorial Clinic, and Vedic.
We're going to be opening 2 new facilities next week, one at Yaba and one in Ikeja. And we have plans for more. So we are building robust capacity for isolation, coupled with our home-based strategy.
And to make sure no one slips through the cracks, the 20 testing centers in the community are to more than double to 57, with the added responsibility of making sure the home-based program runs smoothly.
In Ogun State, the management of the Federal Medical Center in Abeokuta, its capital, has confirmed that 8 of its workers have tested positive for COVID-19. The head of public relations and communications in the center, Mr. Segun Orishajo, says that the affected staff consist of medical doctors, nurses, and an administrative officer. They were said to be part of the team that had contact with a 2.5-year-old coronavirus positive toddler currently receiving treatment at their isolation ward. The positive status was detected during the round of contact tracing carried out by the hospital infection control team. Mr. Orishajo added that none of the staff had so far showed the symptoms of the virus, but have been asked to proceed on self-isolation, and basic treatment has commenced on them. Moving to Niger State, where over 600 mercury children mopped up from various local government areas are to undergo testing for COVID-19. The children, who are currently accommodated at an isolation center at the Mina Hajj camp in Boso local government area of the state, are those repatriated from 19 northern states of the Federation. The state government explains that the sample collection will take less than a week, and those who test positive will be further quarantined and treated in Niger State while others who test negative will be repatriated to their various states to reunite with their families. Emperor Simon has more.
Almajiri children in their hundreds marching into their isolation center at the Arch Camp in Mina after being mopped up from across the 25 local government areas of the state. Before going in, they're forced made to wash their hands and then supplied kits they would need while at the isolation center. Then their data are collected and saved in a database, an exercise the state government says is in line with the agreement by the Northern State Governors Forum.
We have about 604 Almajiris as of today. When they come, we register them and we take their blood samples, and once their results are out, we return them back to their respective states.
The process of sample collection makes some of the Almajiri uncomfortable. Oblivious of what they are here for, some of them appear bewildered as they queue up for what's next. Over the next 1 week or two, the Almajiri are expected to stay here until their results are out, raising concern about how much the government is willing to give them for their welfare.
The major challenge has been with the children themselves, because initially they came scared. They don't know what their fate is going to be, but I'm sure we have tried as much as possible to dignify them. Their welfare has been the paramount priority of the government. They have their square meals, they have their basic needs, so they are believing in us. The stay is going to be very short, and very soon they will return back to their respective states where they would be with their parents.
80 Almajiri children were earlier mopped up and brought here by the state government, out of which 11 tested positive, but they've all been treated, discharged and reunited with their families. Emperor Simon, Channels Television News.
Thank you, Emperor. But staying in the North Central region, as the number of confirmed cases stand at 47 in Benue State, socio-economic activities have really taken a plunge across board, and sporting activities are not an exception, as preparation for the National Sports Festival, the Olympics, and the latest bid to end the Nigerian Premier League as part of the impact of COVID-19 are still on the board. The Commissioner for Sports and Local Government, Ladi Ajede Isegwe, laments the amount of effort and resources committed to the games and competitions have all gone to waste, rendering athletes idle and shut out of earnings arising from our engagements.
Within the last 2 weeks, Benue State has witnessed an upsurge in the confirmed cases of COVID-19. As at today, there are 47 confirmed cases of COVID-19, with 16 patients discharged from the hospital, while 6 medical workers have also tested positive. A family of 8 all tested positive in one of the days. Another occasion, 12 persons tested positive from the state. That means that we have now gone to the level of community transmission, and this is impacting on general activities, lifestyle, and the COVID-19 community in the state is worried about this particular stage we are. This is also affecting sporting activities.
Aside the physical activities, you all know that some of these athletes depend on the sports for their sustainability, their main source of livelihood. These have been shut down, and the youth, like you rightly know, they said an idle mind is the devil's workshop. These youths who would have been fully engaged in sporting activities have been put idle all these months.
We have a burden of taking care of players, paying them when they're not doing nothing. You know, other companies are closing shop, but for us in Lobi, we are paying. And you know where you pay people without them doing anything. So, but the government, in its own magnanimous way, said, look, we pay them even throughout the pandemics.
It appears that the gains made by Lobby Stars to consolidate on the league table may have been hit by the setback of COVID-19. So it is with the National Sports Festival preparations, Edo 2020, where the state contingent had even received funding to prepare and move to camp. But you see, this is also taking a toll on the athletes themselves. Now they are doing nothing. They have no appearance or match bonuses, and this is affecting their economy. If we must recover from this lost ground, then training sessions in batches must be organized for these people to come back to what they know how to do, to get better when this season or whatever games resume, and they get at what they do best. From the Aparaku Stadium in Makodi, Pius Angbo for COVID-19 update.
Thank you, Pius. Residents of Imo State in the southeast have also been speaking about the effects of the absence of sporting activities. Our correspondent, Itokwe Kutei, has more.
Over 1,400 COVID-19 tests has been carried out by the Imo State government. This is according to the chairman of the COVID-19 task force in Imo State, Professor Maurice Iwu. He disclosed it at an enlarged security meeting with head of security agencies in Imo State when they met to discuss the enforcement strategy on the guidelines and protocols put in place by the state government to contain the spread of the virus. Professor Iwu also disclosed that the major challenge against the fight of the pandemic is community transmission.
The cumulative laboratory samples that our state has done is 1,461, which is about one of the highest in the country in terms of states that are testing, and it's definitely the highest in our zone. During our meeting this afternoon, we reviewed the level of compliance, and we have agreed that we form 4 teams that will be going around the state to ensure enforcement, both from the transport sector to the hotels to the markets. Each of these areas will be headed by the commissioner in charge of those ministries. Again, this is not the time for stories. As I keep warning and cautioning, certain things are above politics. We are talking about our lives here. And I want all Imo lives to work together, support our healthcare workers who are on the front line, and then see how we can get out of this pandemic together.
Only yesterday, the state recorded 22 new cases, which brings the total of COVID-19 cases in Imo State to 269. From Owerri, the Imo State capital, Itokwe Kutei, for COVID-19 updates.
Thank you, Itokwe. Over 125,000 COVID-19 samples have been tested so far in Nigeria, although it's a far cry from the 2 million test target set by the Nigeria Center for Disease Control, the NCDC, in April. A total of 22,614 COVID-19 cases have been confirmed, as published in the latest NCDC COVID-19 situation report. Looking at the demographics, the males account for a little over 15,000 of that number, while the females are 7,580. 7,822 patients have so far been discharged, while confirmed fatalities stand at 549. The Southwest, North Central, Northwest, and South-South regions have the highest number of confirmed cases of COVID-19 in Nigeria. The top 5 states in these regions are Lagos with 9,482 cases, the FCT with 1,656, Kano has 1,191, Oyo 1,188, and Rivers with 936. Restrictions on travel, physical activity, and mass gatherings because of the COVID-19 pandemic have had major implications for athletes and players. With the restrictions of access to training venues, cancellation of events, and loss of earnings, global sports organizations are reviewing their rules and regulations to cope with the new normal.
Since its outbreak, the COVID-19 pandemic has spread to almost all countries of the world. Social and physical distancing measures, lockdown of businesses, schools, and overall social life are becoming commonplace to curtail the spread of the virus. The sporting world has suffered a major hit as international competitions are being cancelled or postponed, causing the governing bodies to count their losses.
These 800 million consist of two major parts. There is one part of 650 million, which refers to the costs for the organization of the postponed Olympic Games for the IOC.
Aside the huge financial implications, new ways of participating in sporting activities have been implemented as rules and regulations are being reviewed to incorporate the new normal. New rules on training regimes, absence of spectators, creating virtual viewing of events, players' contracts negotiations, and setting the minimum attendance at any sporting activities have been formulated.
We've got all the LTA rules there, a notice on the gate, so we have to make sure that we socially distance at all time. We don't use the same balls. We hit people's balls back to them by kicking them or taking them up with our racket. We have to use hand sanitizer. We recommend people use it before coming on the court or leaving the court. If we change ends, we have to change either side of the net so that we don't pass each other.
Stadium and other sporting facilities are being reorganized. Decontaminating equipment have been fixed to ensure safety. World Football Governing Body, FIFA, adjusted its regulations to increase the number of substitutions from 3 to 5 to adjust to the new ways and has been adopted by the various continental bodies. The pandemic reveals the hidden potentials of electronic competitive gaming, otherwise known as esports. Esports might not be much of a consolation for hundreds of millions of dollars lost in major events, but it is an interesting development in the COVID-19 era.
Van der Linde alongside him and we go green at home. Pretty slow start.
With the pandemic looking likely to be with us for some time, the entire sports ecosystem will need new ways to deal with threats to financial and business continuity arising from disputed cash flows, legal and insurance challenges, and possible impacts on longer-term attendances and engagements.
We'll take a break, and when we come back, we'll expand our conversation about sports in the era of COVID-19. Please stay on with us. Thanks for staying tuned. Welcome back to our COVID-19 update. Joining me in the studio is a public health physician, a friend of the house actually, Dr. Jamiu Ganiu. Thank you once more for coming in.
Thank you very much.
I'm going to raise two sets of issues with you. One, of course, is the sports that we've just talked about. But before that, let's take a look at the COVID-19 figures, the situational report from COVID-19 for today. Some of the stats are consistent, more males than females, the same regions recording higher cases than others, and Lagos has just said we should expect even more cases. That's the Lagos state government now, and says that it is preparing for that. Speaking from your perspective, is all this as it should be? Is it normal?
Well, I wouldn't say it's normal, in the sense that as a public acquisition, I would expect that we spend more time, more effort on the preventive measures. Because by the time we are talking of, building more or establishing more isolation center, testing, increasing laboratory testing, that means we are, instead of us to prevent more cases, it's like we are expecting more cases, which I don't think is right. All efforts should be channeled more on how we are going to kind of reinforce all the preventive measures and see as much as possible to see that we reduce cases. Look at, for instance, what happened yesterday in a center in the southern part of this country,
right,
where despite the fact that with all these messages, reinforcements, you could see people packed in one place, there was no social distancing. I don't know who told them that just wearing of masks can prevent them being infected with the virus. There was no hand sanitizer, no washing over, no soap, nothing. I think I will advise that our effort, we spend more effort on how we can prevent transmission, the community transmission itself. And we can, I will be able to look at it this way. What are the, we'll be able to carry a kind of small situation analysis. And what I observe is that, whether I like it or not, some people are still ignorant of this information about COVID-19. They don't know. Forget the fact that we are able to translate into the 3 major languages. We have other languages. Have we been able to do that? That's one. How about the situation of people in the rural area? Are they aware of this? Even people that are educated, there are a lot of misconceptions, distortion of information. Today you hear that asymptomatic cannot transmit. Tomorrow you hear that they can transmit. So there will be a lot of conflicting figures, which has put people in a situation whereby they just take their destiny in their own hands. So I think for me, as a way forward, how we advise, we intensify our awareness campaign. And either through radio a campaign, that is, WHO also talk about Hero campaign, in which people that already recover from this can be used as agent of change. That is, they'll be, be involving awareness campaign, sharing life experiences and so on. Then we can also do media van campaign, which is also another strategy. Round. It's been found that is also very effective, because people will say, why are people not complying? There are even some particular set of people, according to psychologists, they call them outright refusers. No matter the level of education, they just will not intentionally they will not, and they are a threat to people. When there are some people, part of those set of people, the attitude make them to not want to adapt to new kind of change. And what they do is that they will say, oh, God forbid, I will never be affected. So this kind of people, we need some level of law enforcement. We need to, we may say, okay, it's affecting civil liberty or whatever. But even when it happened in Italy, there was some level of that. We should start thinking in that line.
And then in any case, people will tell you that public safety trumps any individual liberty, because your liberty ends where somebody else's own begins.
So those are the issues. And again, I'm using this meeting as to also advocate and advise our leaders that you cannot be advocating, creating awareness on an issue in which you are not also complying with such measures, like what happened in Edo yesterday. I'm sorry to say, you can't be saying, oh, you want people to wear masks, to abide by the physical distancing, you want people to watch out, whereas it shows yesterday that you are not doing so. People will think this is just a measure, because already people have started thinking that it's government is just cooking figure, it is not real, it's just malaria and so on. So I think we need to repackage our messages, and that also goes to the issue of, at times, the stigma is another issue I want to say here. We should select the language we use. People, for instance, people who are affected, or people who were infected, not people victim of COVID-19. You get it? A different story. So, and again, I was reading about someone who said he just went for testing. At the end of the day, people started, his name was everywhere that he has COVID. So we need to actually repackage our strategy and let our leaders be a role model. But I will emphasize, please, I don't know, let's emphasize more. Let's spend all our efforts more on prevention. Because the more we get more cases, the more our health system will be overwhelmed and will not be able to cope with it. So that's why. The
PTF, as a matter of fact, on Monday did also on Monday and then yesterday again talked about using Brazil as the example. And we all know what's happening in Brazil at the moment. Dr. Jani, let me ask you about sports now. Okay. One area of normal national life that has been affected is sports, and that's also global. But it appears as if we're exercising a lot more caution. In other parts of the world, some of the sporting activities have started again, albeit under some restrictions. But here, it seems as if everything is still in the cooler.
Yeah.
Is there a reason, do you think, for the difference?
I want to be, we're in the second phase, right, really?
Right.
When the level of compliance in first phase and second phase is relatively low, I think maybe the government is just trying to play safe. But I think we're able to comply with those measures, during the first and second phase of easing of lockdown, I think there are guidelines to restarting of sports, or which you can see the Premier League have started. Despite the fact that UK have a larger number of cases
than we are,
they are still able to manage it. But my worry is that, do we have the capacity to enforce compliance? That is the major issue. If not, the guideline is there. And for instance, what they did in UK was that they ensured that they screen all the players, all the stakeholders 3 times. And they ensure that all those players are kept in the hotel. From there, they go and play their football. And they ensure that they maintain social distancing. I've been watching those matches. And for those staff, the coaches and so on, they make sure that they wear their face masks. And they also ensure that they don't share maybe water bottles and so on. So another thing they do is that they wash their hand before and after either during practice or during competition. Then another thing is that if we can do it here, is that usually there's what you call a symptom checklist. As somebody is coming, they take information about that person, they take the temperature of that person. There's what you call sign-in register. The purpose of that is that, in case there is any suspected case or a confirmed case, they can easily line list from those sign lists.
Right.
Then the equipment, they ensure that before and after use, they are decontaminated. That's another approach. And they also emphasize the fact that they do not touch their hand or unnecessarily touching surfaces. Then another thing is that they ensure that locker, nobody's, usually you have locker attached, right, taking shower and so on is not allowed anymore, because to avoid issue of not abiding by social distancing. Even in the lavatories and so on, they will ensure that they regulate to maintain social distancing with wearing of face masks. And you don't expect the usual number to go in. Right. So they will regulate the number of people that go into the sport arena. And one other thing is normally done in phases. Usually they emphasize more of the outdoor sports for the first phase. Then subsequently, when the compliance is high, they cannot go into indoor, because the major issue is the indoor, because everybody is
inside one place and there's no opportunity
for that. So those are the issue. Yes.
All right, thank you very much, Dr. Jamiu Keniu, for all that insight. Thank you for your time.
Thank you.
Let's go now to Onitsha in Anambra State, where we are joined via Skype by Alfred Okologwe, who is a sports journalist and commentator. Good evening, Alfred. Nice to have you online, especially during this period of COVID-19.
A very good evening, and it's a pleasure to join the studio live from the city of Onitsha.
Let me begin by asking you. Sports has been very much affected, and our doctor in the studio here has talked about quite a number of precautions taken in other parts of the world before sports was restarted. The sports were restarted there. And that partly, maybe part of what is delaying us here is that even the other simpler things we were asked to do earlier, we haven't been able to do those successfully. How will sports fare? Is that a fair comment, do you think?
I think it's a fair comment. For me, I think it's that of capacity. It's an issue of capacity, because elsewhere, it's kicked off. Perhaps the explanation that was given to us was that elsewhere it's a business and they're making so much money from it. So they've put up protocols that you follow to start sport. But you beg the question, there are people too who are in the economy of sports here back home, because when you look at the Nigerian Premier League, if you look at the entire ecosystem, there are people who make their living not only as players, but if you look at the entire process, there are people who, as officials, as suppliers, as vendors, who also make the money. I think it borders on capacity, because if we have the capacity to put in place the protocols that we have elsewhere, having perhaps you go through the process of disinfecting, or rather taking care of the places in a controlled environment. You don't go out, you test people, the participants, maybe the referees and those closely, those who are closely involved in running of the sport. I think will be taken care of. So just leaving it lying there to say that, hey, maybe we can't continue. Because I think it's a question of capacity. If we have the capacity to test, to make sure that we disinfect our environment, provide conducive places for, like a controlled environment, I think we can get this started with. But for now, it's more of we're trying to keep people down, keep them indoors, but it's not happening. For example, in Onitsha, where I happen to moved around town yesterday, you talk of social distances. For example, in Lagos, you say, okay, the tricycles, 2 passengers per the rider. In Onitsha, it is 6 passengers. 6 passengers, 2 in front with the rider and 3 at the back. The buses are still packed. People, as if life to them is normal, as if they've not heard what is happening, or they don't know the dangers involved with, mixing community infection and the rest of it. It's like nothing is happening. Nobody is checking it. No government is taking care of. Face masks have turned to shin marks and the rest of that. Nobody's saying anything.
Indeed, Alfred, thank you so very much for that. It is a shame, though, that the precautions are also not being complied with there in Onitsha. We do hope that at some point in time in the future, we will be able to restart sports and get gentlemen like yourself back on the various shows that treat sports around the globe. Thank you very much, Alfred Okologwe, joining us from Onitsha via Skype tonight. Small and medium-scale business owners in Yobe State are asking the federal government to look at the possibility of reopening sporting activities in the country to improve the economy. Investigations conducted by Channels Television indicate that many are gradually losing their means of livelihood as a result of shutting down of sports centers.
Sport is a major contributor to economic and social development, but the outbreak of the COVID-19 has disrupted many regular aspects of life, especially physical activities. In Yobe State, from sachet water vendors, snack sellers, local transporters to local food vendors and guest houses, everyone has been affected by the shutting down of sporting activities due to the coronavirus.
Things have changed. Before now, during match days, people come from nearby communities to the stadium. Sometimes I make up to 7,000 naira a day, unlike now, when things are difficult.
Government institutions and hotels are also not left out as they count their losses.
In terms of revenue generation, it has really affected us here in Yobe, because we have some revenue generating facilities here, just like the gymnasium, the indoor sports hall, the cafe, the restaurants. But due to the COVID-19, we have to put them in a total lockout.
A hotel that has, I can say, a lot of rooms and accommodates so many people before the pandemic, we can only now receive not more than 5 to 10 people a day. Sometimes we may even, throughout the day, will not even receive or accommodate any guest here.
States like Yobe, which is yet to recover from the pains of the Boko Haram insurgency, are now battling with the economic crisis caused by COVID-19. To boost the economy, the government must reopen sporting activities and make it mandatory for all to observe the safety protocols.
Beyond our shores, South Africa is gradually easing out on the COVID-19 pandemic as it enters its level 3 lockdown. Activities are beginning to gear up in the country, but with strict restrictions. Government says only contact and non-contact sporting activities is allowed for now. Our South African Bureau Chief, Betty Dibia, has more.
In March this year, a gathering of the various sporting bodies debated over the money that would be lost, the lives that could be lost, and if the end of the suspension of sporting activities could be anywhere close to the horizon. Now in June, things have shifted a bit on the level 3 lockdown for contact and non-contact sports.
Non-contact sports such as tennis, golf, cricket and others. Contact sports will be allowed only for training and modified activities with restricted use of facilities.
all sporting codes would be expected back on training. You would realize that our athletes have not been in training, and we do not want to have them out of shape forever. So the process of training would ensue for both contact and non-contact sport. And we are correct to say that from the point of view of non-contact sport, it's both training and resumption and of playing. But from contact sport, it's only at the training level.
All sporting bodies have a list of safety regulations they must fulfill before they would be given approval by the Sports Ministry to go and play or train. The Premier Soccer League just got its plan approved for training to begin. No spectators are still allowed.
All sports bodies and professional clubs must develop and implement policies and procedures for their workforce contact tracing following employee COVID-19 test. All sport bodies and professional clubs must ensure that athletes and their support staff be subjected to quarantine for 14 days pending the test results.
Despite the many meetings and government's efforts to yield to demands up to a point, a number of stakeholders have described the regulations as littered with contradictions and irrational exclusions. They are seeking more clarity on the regulations. Already a number of confirmed COVID cases have been recorded in some soccer clubs. 7 of the cases are in cricket, a non-contact sport, which has put events in that sector on hold. From Johannesburg, South Africa, Betty Dibia, Channels Television News.
Betty joins us on the line now via Skype from Johannesburg. Good evening, Betty. Most people listening would assume that if there were to be infections or confirmed cases, they'd be in the contact sports. But from your report there, non-contact sports have actually more or less like kicked off the issue of infections. How have sporting activities gone on with all the rules you've described?
Well, the first thing that the government has put in place, or the department, is a long list of regulations they have to fulfill, and they have to present a plan. Many were excluded. Now they've included those who have been approved, now including cricket, to train and to have matches as well. Cricket, anglers, gymnastics, climbing, canoeing, and swimming. So remember, the people, those who have tested positive, they've been in contact with other members or other people outside the sports industry. So the part of the regulation is the testing of athletes. And if anybody tests positive, they will have to stay for the 14 days till they test negative. If not, they may not be part of the setting. And another part of the list is to have a waiting period, cleaning and disinfecting the arena that they're going to use, appointment of a compliance officer among every other, as well as identifying an isolation center. So this evening, we got the added list of people who are allowed by the department now after submitting plans of compliance to all these regulations in order to I guess, keep people safe, the worker, the staff, as well as the athletes as well.
The spectators, how are they reacting to the fact that for many of these sports, they're going to be played, without people watching them in the stands? Most people will probably be watching from home, I guess.
I guess better safe and alive to watch than, be there and be. The main thing is that they're avoiding a crowd of very, very vibrant spectators. So people are hoping that this will end soon, just like everybody else. They're looking for rugby, for example, the Pro 14. They're looking at probably in August to start. But
the issue of spectators, they're still not going there. According to government, that will still be watching. We're not yet at the peak of the COVID testing, and today we stand at 124,590 of confirmed cases. So spectators not allowed yet. Better you have it and watch on TV than to be at a place where you're not safe. But it's not the same for the spectators. But hey, better safe than alive than be there and contract the virus.
Is there anything you're hearing that would probably suggest that under level 2, some of these restrictions might be lifted?
Not really. They're still watching the numbers. It's the numbers first. How are we headed regarding infection rate, mortality rate, and the numbers? That's what they're looking at. So if things improve, or if the country reaches the peak, that according to the scientists, maybe things will change. But now, I guess the athletes, for example, are happy to even be able to train, instead of just being there and waiting. So being able to train, but some of the sports are allowed to have matches as well. So it's a waiting thing for the numbers again, and the safety of the people.
Thank you very much, Betty, for your reporting, and do continue to stay safe out there. Betty Dibia joining us from Johannesburg, South Africa. As global coronavirus cases climb to 9.63 million and the death toll reaches just under 460,000, the United States still sits highest in cases and deaths, following a recent resurgence of infections. With a daily increase of 40,000 cases, the United States has set a new record for the largest daily increase in infections.
The United States has recorded an all-time daily high of 40,000 coronavirus cases on Thursday, June the 25th. U.S. health officials have also said they estimate the true number of cases is likely to be 10 times higher than the reported figure. The U.S. has 2.4 million confirmed infections and more than 124,000 deaths, more than any other country. The recent resurgence has resulted in several states halting their reopening plans.
I believe if the numbers continue to rise at this pace, Houston is on track to become the worst affected city in the United States.
In Italy, dozens of riot police and soldiers have been sent into the southern city near Naples to subdue disturbances after over 40 people tested positive for the new coronavirus in a residential complex. Now, 700 people have been placed in a so-called red zone quarantine for 15 days by the regional governor. Clashes between the foreign workers and locals began on Thursday as the Bulgarians tried to leave the zone to go to work. Over in Britain, after thousands descended on the beach to beat the heat in Bournemouth East, the MP is calling for the creation of a national situation centre. MP Tobias Elwood added that Britain needed to make sure no beach looks like it did this week until there is a vaccine.
Remember to wear your face masks and ensure it covers your nose and mouth with no gaps. That's one of the pieces of information you'll find on the website of the NCDC. The health agency says face masks can reduce the risk of contracting or spreading COVID-19. You can also visit the websites of the World Health Organization for updates on national and international responses. Channels Television's website, channelstv.com, also has updates on everything concerning the pandemic and indeed other stories from around the world. Thank you for watching. I am Ladi Akiridoluale. Have a good weekend ahead.